Hello and welcome to another episode of A Slice of Health, the Candid Health Chat podcast, where we slice away health truth from health fiction. Join me and my friends as we challenge common health myths via chit chat, powered by several cups of coffee. Don't forget to subscribe and follow us on social media, and do visit us at asliceofhealth.club. Let's get to today's episode. Welcome back to A Slice of Health, where health comes alive, with bite-sized health education to keep you moving and become your own health champion, with stories that heal and knowledge that empowers. But before we jump into our topic for today, I want to tell you a story. Jennifer is a 55-year-old woman who has recently been hearing a lot about gynecological cancers. She heard that September is Gynaecological Cancer Awareness Month. She's not quite sure what that means. She knows that gynecology refers to the care of women's issues such as bleeding problems, sometimes relating to the menopause, but she wants to know a little bit more. She's gone online to look at what the symptoms of gynecological cancers are. And now she's worried because many of these symptoms are symptoms that she has experienced at some point or another in the past year. She wants to know what exactly should she be worried about, because a lot of these symptoms seem vague to her. They seem like things she has experienced on and off for most of her adult life. She wants to know why these symptoms are so common with gynecologic cancers. What exactly does it mean? And should she be worried? Now, today we will talk about September being Gynecology Cancer Awareness Month. Gynecology basically refers to the care of women's health. And that means anything that has to do with the reproductive system of women. Sometimes we split it into gynecology and obstetrics, where obstetrics on its own refers to the care of women in and around the pregnancy. Now, gynecology cancers refer to any cancer that affects the reproductive system of a woman. This includes the cervix, the ovaries, and the womb. Jennifer has a question. She says that a lot of the symptoms that she has seen online for Gynecology Cancer Awareness Month are concerning because she has experienced many of these. Some of the symptoms that she might have seen online include things like persistent bloating, pain in the pelvis, pain in the tummy, changes in going to the toilet, or changes in passing urine or doing a poo. These symptoms can be rather vague, and so Jennifer's concern is actually accurate. There are some other symptoms with gynecology cancers that can be a bit more concerning, such as bleeding in between periods, significant changes in your periods, like them becoming heavier, bleeding after sex, bleeding after the menopause, which is never normal, or blood staining on vaginal discharge. All these symptoms warrant a doctor's review, an assessment to see if anything is amiss or if anything is currently wrong. And so when someone presents with vague symptoms, the concern then is something else going on? Could something potentially be being missed? Let's talk about some gynecology cancers today, and then we'll be able to see if we can give a recommendation to Jennifer about what she should do when she goes to see her doctor. Today we will speak specifically about cervical cancer and ovarian cancer. Cervical cancer is a cancer that's found anywhere around the cervix, and it's quite common mainly in women around the age of 30 to 35, but anybody can get cervical cancer. In cervical cancer particularly, there's an infection called the human papillomavirus. You might have heard of it referred to as HPV. This virus can often be implicated as a cause in cervical cancer. In fact, almost all cervical cancers are caused by this virus, which is why there is a screening program that checks for this virus so that treatment can be issued early, sooner rather than later. Also, there is a vaccination program that is usually given to young girls and some gentlemen to also reduce the risk of having conditions related to HPV. Some of the symptoms of cervical cancer can be bleeding from the vagina, changes to vaginal discharge, pain during sex, which is never normal, pain in around the pelvis and around the tummy. So, if there are any symptoms like these that are not usually related to another condition which you already know about, like fibroids or endometriosis, then it's important to have these checked out. Now, as I mentioned, HPV is one of the most common causes of cervical cancer. And HPV is normally transmitted from sexual activity. However, there's other ways to get cervical cancer as well, especially if you have a weakened immune system or if there was exposure to certain medications in the mother of the person that is affected. Also, smoking can also be implicated in cervical cancer, or cancers in and around the pelvis, like having vaginal cancers, vulval cancers, or cancers of the bladder or kidney, can also increase the risk of having cervical cancer. So it's important that anyone who has those kinds of symptoms have a chat with their doctor. And if they're not yet signed up for screening program, then to make sure that they speak to their doctor or their local health clinic as to how they can get screening for HPV and cervical cancer. The next gynecology cancer that I'm going to talk about today that also has vague symptoms is one called ovarian cancer. Ovarian cancer, as I'm sure you've guessed, is cancer of the ovaries. Now, ovarian cancer in particular also has rather vague symptoms. This is because the pelvis of a woman is actually designed to accommodate a lot of enlargement because it was designed to potentially get pregnant, which means that if a woman has a tumor in her ovaries, it might take a while for her to notice. Some symptoms include a swollen tummy, feeling bloated, pain and tiredness, no appetite, or a change of appetite which might result in someone feeling quite full after eating only a little, or an increasing need to pee because an enlarging ovary with a tumor potentially is pushing against the bladder. Now, as I mentioned, many of these symptoms can sound quite vague. Feeling a bit bloated, feeling like your tummy is a bit bigger, needing to pee a bit more often than usual could potentially be a change in diet. It could be a fibroid. It could be as a result of drinking a lot more caffeine. It could also be a sign of diabetes. However, the most important thing is when new symptoms have been noticed, having them checked by a doctor. So, what are the causes of ovarian cancer? One of the main causes of ovarian cancer is having something called the BRCA gene, which is linked in families. Also, having had breast cancer or bowel cancer increases the risk. In some situations, some people who have had endometriosis or diabetes might also have a higher risk. Smoking is also implicated in ovarian cancer. So, now that we've gone through two of the major gynecology cancers, we want to answer Jennifer's question. Some of these symptoms are very vague. But the most important thing is when you notice that something has then become a pattern, you've noticed that actually you're getting a lot more bloated, you're getting a lot more exhausted, your tummy feels full, you're getting pain that you didn't used to before. Remember, I always say, pain is always your body's way of telling you that something's wrong. So if Jennifer is experiencing any one of these symptoms, especially this month of September, which is Gynecology Cancer Awareness Month, we'd encourage her to speak with her doctor, let them know what's going on, share some of her concerns, and see if there's any investigations that can be done to help identify the problems. So there we have it for today. Until I'm back in your ear tomorrow with stories that heal and knowledge that empowers. Bye for now.
Thank you for joining us on today's episode. Remember that this podcast in no way replaces the advice you receive from your own doctor or physician. Don't forget to subscribe and follow us on social media. Leave us a review on iTunes so that others can access the amazing content. And don't forget to be a health champion wherever you are by separating health fact from health fiction.